This is Bob, just a child now. His ability to regulate his emotions is due to appropriate responding, sensitivity, and support from his parents. However, when parents have emotion regulation problems, like those seen in psychiatric disorders, it can lead to an insecure parent-child relationship and later, possible diagnosis of psychopathology in the child. Many childhood psychopathologies, like depression and anxiety disorders, have a component of emotional dysregulation. But Bob has more immediate worries. A car crash sends Bob to the hospital and initiates a cycle of pain localized in his right arm.
That was so quick.
Now, let me show you. Let your arm fall. Look at your fingers. This is Lord. Watch this. 1, 2, 3. Listen. This is number 1. Okay. Open. This is number 2. This is number 3.
Now that Bob is a young adult, his arm still hurts. The chronic pain is accompanied by depression and anxiety. Comorbid psychiatric disorders have implications for the impact and outcome of pain conditions. There is evidence for a reverse causal link and shared risk factors, including distal events occurring in childhood. Chronic pain isn't only associated with severe and long-lasting pain. It has been known to have multiple comorbidities, among which is depression and anxiety. There are many similarities between the plasticity which allows our brains to learn and remember, and the plasticity underlying the development and maintenance of chronic pain. Bob's memory of his traumatic car accident has been maintained, and even though his arm is perfectly healthy, he still feels pain. Bob's anxiety and depression is also maintained by the memory of his previous mental states. With the comorbidity of chronic pain and psychiatric disorders, Bob has a reduced quality of life. For example, it is difficult for him to maintain a job. It is also difficult for Bob to maintain healthy relationships. Annual medical costs to treat chronic pain and psychiatric disorders in America is as extensive as $635 billion. Drugs are expensive and ineffective in treating chronic pain. Psychiatric disorders can be caused by chronic pain, and chronic pain can be caused by psychiatric disorders. Bob is exhibiting a very common symptom of borderline personality disorder. People with this disorder have a difficult time regulating their emotions due to a hyperactive limbic circuit. This can lead to intense emotional pain. Self-harm is an attempt to activate regulatory prefrontal mechanisms. With this relationship pattern, psychiatric treatment may or may not improve chronic pain depending on the direction of the link. But there is hope without drugs. Psychological treatment of pain has been successful in patients reporting comorbidity of chronic pain and anxiety. Therapies that are shown to be effective in patients with comorbid chronic pain and psychiatric disorders include cognitive behavioral therapy, exercise, and mindfulness meditation. Psychotherapy for chronic pain primarily targets improvements in physical, emotional, social, and occupational functioning rather than focusing on resolution of pain itself. Bob has found a treatment that doesn't involve pills, and he's all the better for it.